Well, good evening. So we're told the importance of making a good impression to our patients, our staff, and our colleagues. But I didn't understand the importance of that until I got to learn more about Adeleke Adesina. So I first learned that he graduated from Bloomfield College in 2008 with highest honors majoring in biochemistry. So it's not a surprise when one of the ROWAN SOM faculty who used to teach him described him as being very bright and doing very well on his exams. One of the deans I also talked to about him told me that they used to have conversations about what improvements could be done to the medical education. She personally told me that as they were talking, he was thinking about ideas about how to improve medical education and how it was taught. So in 2010, himself being a third-year medical student, he started his first online medical education company, Future Teaching Physicians. This is a company that uses online medical films to better explain and educate students about different medical concepts. This program has now grown and branched out to include online medical videos and resources in the fields of medicine, nursing, pharmacy, and physician assistantship. Not only that, but he also authored a book known as How to Prepare for the Medical Boards, Secrets to Success on USMLE and COMLEX-RN. Very long title, but very much necessary. And he also did 2 Medscape articles at the same time. All of this before graduating from medical school. His highest honor that he received while here was being inducted in 2011 into the Gold Humanistic Honor Society. Now, once he left medical school, he finished his residency in emergency medicine in Pennsylvania, and he has now moved to be an attending emergency medicine physician at Houston, Texas. And he's balancing being a husband, a father, an emergency medicine physician, a mentor to the many people that he mentors through his online diverse medicine program, and is still the current CEO of the company he started in 2010. It is easy to say that not only did Dr. Adesina leave a good impression on ROWAN SOM, but a lasting one. I'm confident that tonight he's going to leave another lasting impression on all of us. So it is my pleasure to introduce to you all Dr. Adeleke Adesina.
Thank you everybody. First, I'm very excited to be back. And thank you, Taiwo. First, I want to thank the Dean Cavallari. It's good to see you again. I want to thank everybody that made this event possible today, the NCLEX board. I want to thank all the supporting staff. I see Dr. Chanel, Dr. Lightfoot, Dr. Olsen, all the people who have helped me as I went through this journey. I really, really appreciate you guys. Thank you for having me to honor, and a humbling experience to be able to come back and give back to you guys. I really appreciate it. Thank you so much. So today we're going to be talking about vision to move forward. And when I heard what the title and the theme of this Black History Month was, I could not even think of anything better. And what I'm going to do today is kind of share with you guys the journey that I went through medical school and training, and tell you some of my failures as I went through my education, and also some of the successes I had along the way, and what I can, leave you with some words here today on what you guys who are the next finest physician that ROWAN SOM is about to produce. Let me see where oh, there it is. So, that's me. First year of medical school. All right, so one of the best days of my life aside from my wedding day. I'm going to talk to some of my failures. We're going to talk about my journey through medicine, and I'm not here to, brag or anything like that, but I want to kind of, invite you through the journey of the thought process of how I got through this whole process until who I was today. How I ended up becoming an entrepreneur, my life in residency, and I'm going to share with you guys the 10 secrets to success that I've learned and mastered over the last couple of years. So first of all, when I applied to medical school, I applied to 12 schools, 4 osteopathic and 8 allopathic medical school. And of course, I got rejected at 11. Thank God I got into ROWAN SOM. And you know what? In life, that's all that matters, right? You can keep trying hard and hard. All it takes is one person to believe in your dream, and the rest of your life is history. So one thing I struggled with earlier was when I was taking my MCAT, I was scored persistently low in the verbal section. I was a good science student, but verbal was my problem. So I took the MCAT twice, and I realized that was a big determining factor why I couldn't get into medical school. But what I've learned from that was that somebody told me once that, well, since you're not doing well in verbal, you're not going to pass the boards, because our studies have shown that students that don't do well on the verbal and the MCAT cannot pass the USMLE or the COMLEX. I said, how does that make any sense? I thought it was a clinical exam. So I was bound to prove my critics wrong. I said, if somebody can give me a chance in my lifetime to let the dreams that I had when I was back in my country, Nigeria, to come 18,000 miles across the ocean to get to this place and to kind of find a way to make it happen, I am going to make sure I conquer this exam. So that was my mission. So when I got to medical school, actually when I got to SOM, I said, oh, I thought they took USMLE here. And come to find out, it was just only the COMLEX you needed to take. But I already had my mind set up. So, but what I learned is that the lesson is that if you get a high score, it's kind of equivalent to more interviews. So my problem earlier was I got a low score, so I didn't get enough interviews. So I said, I learned one lesson. I'm not gonna make that mistake again. All right, this time around when it's time for me to match into residence, I'm gonna make sure I get the score enough to get me interviews. So that's the first lesson I learned. So don't be afraid to fail. We are taught early in life that, oh, you know, you failed, such a bad thing. No, no, no. Failures are practice shots, guys. Failures are practice shots, because if you don't fail, you will never appreciate success. And a lot of people that things are given to in life, they always realize what happened, why they fall by the wayside. It's because they haven't learned to fail. When you fail, it forces your brain to think outside the box. Figure out a solution to get out of your problems. So remember, being a failure is different from failing. Okay, it's okay if you fail, if you end up being there, but guess what? You can always bounce back. That's my first lesson. Now, first year of medical school started, and the first thing I learned was to talk to the people that have gone before me. Now, the reason is because no matter what you want to do in life, somebody else has done it, and why do you have to recreate a new formula? All right, all you have to do is figure out who are the top people in the upper class and get their advice. Tap into their wisdom, and that's one thing I want you to know today. Ask everybody you meet every question possible, and then be selective and pick the ones that actually match what you need. Now, I was very eager to master the core concepts in medicine. I could not wait, read my, textbooks, try to do well in class, and also, I got my first day the first day of school. I had it in my backpack. I was ready as if I was about to go take the boards. It was like preparing for a wedding. So, which I recommend, by the way, if you're a medical student. Guess what? You're going to need to study for the boards. Why don't you have the book from the first day anyway? That's what they do at Harvard. Just do it. So, another thing I did was choose the right colleagues. Everybody wants to form a nice little clique, but I said, I'm going to select people that are going to challenge me. I'm not going to settle for less. I want the person next to me who I'm going to call my friend, or people I'm going to surround myself when we study in those library upstairs and anatomy lab. I want them to be better than I am, because that's how I can grow. Now, I'm my worst critic, because one of the best advice I got in life is you can never outcompete yourself. So I was taught to always compete with myself, because I can only chase my own shadow. I can only become a better version of myself. So I first surround myself with great people, and then I become my own competition. Now, I learned to ask for help early. If I don't understand the topic, I'll call up my friend, go to the professor. I used to go to Dr. Lee's office on the sugar train. I'm like, what is this glucose 6-phosphatase thing? And he'll sit down and just explain it to me. And I said, thank you, that's all I need to know. So if you're a student because you're medical students, we have an ego, right? Ask for help early, okay? Don't be that student that it's too late towards the end of the semester, you're barely passing your classes, and then you say, oh, you know, let me go ask for help now for tutoring, okay? Go early if you're struggling. Don't stay silent. Silent kills people. So, one thing I also learned in first year is to get a mentor. So I went through a class of upper classes above me, and I got a couple of people that I said, you know, I want them to mentor me. I don't want them to tell me what to do every step of the way. And you know what? It was the biggest help I ever got, because, you know, they'll tell me things that I never thought of. A book I should read, you know, a question I should go, an old question that I should look at. And that's what I've learned, that those who stand on the shoulders of giants, they see far. And why do you want to recreate the same formula like I said? Get a mentor from first year, okay? Find somebody you confide with, somebody that trusts you, somebody that believes in you. Somebody's going to give a good critic. They give you constructive feedback, and you're able to work on it, become a better version of yourself. Remember, mentoring, successful people never reach their goals alone. You're not in this by yourself. It's a community, and it's a very small community. You can only get better by having mentors. So second year happened, the dreaded second year, and I had to master in the most efficient method to be able to become more effective, so which means spend less time on things that are not important, and, you know, find quality time to be able to master the content as fast as I can. As they always say, you're drinking out of a fire hose. And I still remember second year like yesterday. I don't want to be a second year again. But that's where you're challenged. That's where you learn the real medical concepts, the pathologies, the clinical medicine. That's what you're going to be a doctor about, us all about. At least knowing the core concepts. And I spend a lot of time knowing that. Now, I always track my own performance to see how I'm doing. Not to my other peers, but okay, if I got a 79 exam, I want to get an 83 the next time, maybe a 90 the next time. And I'm always pushing myself. And what I learned is my performance in the classroom was an indicator that I'm going to be successful on the boards. So I hear a lot of students want to take the USMLE. And I tell them, how are you doing in your classes? If you're a C student and you're barely passing your class, please don't try to take 2 board exams. It's already $500 a pop. And at the same time, it's 8 hours long. And don't take chance if you're not a good student. That probably means you just need to sit the COMLEX and figure out to do really well. I was bound to understand mechanism. Now, medicine is very simple, guys. I know that sounds crazy. Now, I put medicine in a nutshell. Think of it like a car. You learn the parts of the car first, it's known as anatomy. And then you learn how it works. It's physiology. Then you know what makes it breaks down. Microbiology, okay, and that we call that, and whatever makes it break down, whether the immune system or microbes, infectious disease, things like that, it makes your body breaks down. And then it causes a pathology. So you know your car is broken down. How do we fix it? Pharmacology, all right? And that's basically not medicine in a nutshell. Either medicine, you know, physical therapy, whatever management it is, and that's what real medicine is. You pick something from this E state to an E state. So I spend a lot of time trying to understand how things work, because I knew if I understand how things work, I spend less time memorizing. We spend a lot of time memorizing, but if you really understand stuff, I can wake you up at 2 a.m. and tell me 5 top causes of pancreatitis, and you can spit it out in the dime of a hat. Don't think about it right now. So I was up for the challenge. I was going to take the USMLE Step 1, Step 2, COMLEX 1, COMLEX 2, and that was the challenge. But I had a goal in mind. My goal is to get the maximum amount of score to be able to get the most interviews, which increases my chance of matching into residency. And I was able to do that. Now, the lesson I learned from the boards was that the eyes does not recognize what the mind does not see. That was the best advice my residency director gave me in residency. And what it simply means is, if a patient presents to you and has a huge soft tissue swelling over their forehead, and you have never seen something called Pott's puffy tumor in your life, guess what? Your brain is not going to recognize it, which means your eyes is not going to see it. And when you take these boards, it's not just an exam. It's an exam that tests your knowledge of all the aspects of medicine. So someday when your patients present to you, you can recognize something so your mind can recognize it, and so your eyes can see it. And that's what I learned so much from the board, and still today still holds true. Third year, I walked in, I was still medical student with my short white coat into Kennedy, excited, finishing my board exam, did well, and I said, what is my future gonna look like? It's a different arena. I no longer have to sit for long, long hours other than coming back from work to study. And always be open-minded when you start your rotations, okay? Don't be closed-minded. You should be criticizing as they are criticizing you, which means you should be thinking about your future now. Now, the main question in third year is this. Look at your current attending physicians that you're working with. Check what time they show up for work daily and what time they leave. Are they happy or do they look miserable or always tired or complaining? That's you in 5 to 9 years. So don't try to figure out what am I going to look like. Just watch the people you work with. And if you see yourself in them, that's you 5 to 9 years from now. Because if you do general surgery and trauma fellowship or neurosurgery, you might end up 9 years of training. Okay, from now. It's that simple. So, what's your main goal in third year? Well, my goal was to learn the normals. I've learned all the pathology, but you got to understand not taking good history and physical exam skills. So, that was my goal in third year. Not to be able to diagnose the most exotic disease in the book. Okay? Yeah, that would be cute if you diagnose a patient with autoimmune hemolytic anemia, but you got to first know what the norm is. Get used to know the norms, and eventually you recognize the abnormal, because your goal as a physician is to know if your patient is sick or not sick. So that's where the clue is. Good history and physical exam skills. I know you want to be quicker to diagnose, but that's what you really need to master in your third year. Now, fourth year arrives, and I had to pick a specialty. Now, the best lecture I got in medical school was not in the classroom. It was on the family medicine rotation, and I don't remember the name of the doctor that gave me this lecture. But it has nothing to do with medicine at all. It was these two physicians in family practice. We were upstairs in the top docs, and we always had this, I don't know if they still do it, and it was the best advice and the best lecture I ever got, and it's choosing your specialty. And I remember sitting there thinking about my life 5 years or 3 or 4 years down the line. I said, what do I want to do with the rest of my life, and what do I see myself doing? And what basically the better advice was that when it's time for you to pick your specialty, please pick your life first. I know that sounds crazy. Pick your lifestyle first. And then pick your lifestyle first, and then pick the specialty that's going to work around your lifestyle. Best advice ever. If you put medicine first and you fast forward 5 years later think you're going to put your life around it, it is harder to do. That was the best advice I got. And I said to myself, I said, what do I want to do? Well, I want to spend time with my kids, be there for my wife, be able to involve in my community. I want to be able to do all these things. What specialty can I do that gives me that luxury and opportunity to do that? And you got to ask yourself those questions and stand in front of the mirror and be honest. And that's what I did. So, remember, pick a specialty you can be excited doing at 2 a.m. in the middle of the night. When I call my cardiologist at 2 a.m. that I got a STEMI, even if they're in bed, they have to come in. And you don't be grumpy. You have to come in at 2 a.m. to put a cardiac stent in a patient. All right? If you're not excited about doing that, then don't become a cardiologist, because that will be the rest of your life. And we're talking about a 30-year commitment. All right? So, best advice I can give you. Now, as I evolved into third-year student, I stumbled upon how can I make an impact in the world? How can I make an impact in the next generation that's coming that's coming after me? And that's how we came up with the evolution of writing the first book. And it was a success. It was me and Dr. Taha that wrote the book. We actually launched it on this podium. And what that taught me was how to think outside of the box. That is what made me discover my entrepreneur mindset. I rediscovered my passion for teaching and simplifying medical concepts for students, and I noticed I was good at it, and I started my first YouTube channel, and that YouTube channel today has about 7.8 million views and over 110,000 subscribers all around the world. And I started with an idea and a passion, and what I want you to realize, and that's what led to the development of FTP lectures, smash USMLE.com, crush NCLEX, which is even for like nursing students, because once you learn one thing, I was able to discover how to make more things to benefit other people. So my goal was to actually help medical students pass the boards via an online medical education. Now, education has changed from hardcore just medical textbook that sits on the shelf into actual, virtual learning, videos, which is the future. And virtually 99% of medical students, every lecture they watch in a class end up going on YouTube or watching a video about it, because video as basic as is the wave of the new generation. So the thing I learned is the key to success when you find your passion outside of medicine is you have to have passion for what you do, be extremely determined to get through no matter how hard it is, so you don't give up easily. And then the most importantly is to make an impact. Your willingness to help others it's got to be the driving force other than anything else, because when the rubber meets the road, when things are hard, it's really easy to give up on your goals and mission in life. And guess what? Other people will probably give up on you faster than you give up on anything else. So you want to make sure you have these three factors to be able to be successful if you find your passion. And I understand there's a new investor med, like a business club on campus, which I'm very excited about, because I think every physician should have some idea about business, because medicine is also a business. So when it was time to choose residency, I wanted to be close to home. I was looking for a program that I fit in, okay? And I wanted a program that had a balance between didactics, clinical education, and research. And when you actually apply to residency, you should be asking these questions as a medical student. Are they all purely clinical and little didactics? Because guess what? You have to be board certified. So if you know all the clinical stuff and you don't understand the didactic learning, it's not good. If they're purely a lot of didactics and they don't have enough clinical exposure, it's not good either. And also research is important. Okay, so if you find a balance of all three in a program that you're applying for in residency, that's the program for you, because you're going to come out not just understanding core concepts, seeing patients, and be able to publish. And even while I was a resident, I was able to publish 3 different case reports even while I was in residency. So that's the key important thing. And remember, pick a specialty that matches your future lifestyle. Now, the key thing here is, in order to get into that residency, high board scores will always get you more interviews. Doesn't mean you're going to get into the program. It just gives you more face value, because then you have more choices and more options. That's what the board scores really does. Now, residency. Probably one of the hardest things I ever had to do. I wouldn't do it again. It is very, very hard. I'm just going to be honest with you. If you thought medical school was hard, long hours of exhausting fatigue in residency, but it's doable because you're just not the only one doing it. Long hours, 30-hour calls, okay, 16-hour calls depending, and it's a leveling playing field. Everything you've learned in medicine is going to come together as a resident, and that's where you're going to become a real physician, where you have people's life in your hands and you can apply every concept you've learned in the medical textbooks to be able to take care of your patient and manage them. And it's going to be tiring. It's going to be long. You're going to be tired, sleepless nights, being on call, getting yelled by nurses, okay, or still flustered and not know what's going on, all right? But in the end, your ultimate goal is to learn the skills to be an excellent physician. You want to get out there, and when you're by yourself and you have your patient one-to-one, you want to be able to take good care of your patients and become an excellent osteopathic physician. So, get ready for the ride. It only gets better from now. So today, what do? I spend time with my family. I end up being an emergency physician, which allows me to work about 14 days a month. My dad is always asking me, do you work? I said, I'm home today. It's like, it's Monday. Why are you home? I said, I'm off. He's like, I'm not off. I said, yeah, I know. That's why I picked it. It's like, my dad and my mom are here. Please give them a round of applause. It's because I saw myself 5 years before and I said, what do I want to do with the rest of my life? So I'm involved in my church. I mentor a lot of students. My mentor, Mr. Wright, God bless his soul, he told me that, Leke, I I'm given an opportunity to walk into my office today, and I don't know who you are, and these are his words. And I listened to your story. And he told me to come to this school from NGMS, actually. He said, listen, if you can get into an MD school, do you want to be a doctor or just an osteopath? Or just, you want to be a doctor or just want to have letters behind your name? I said, I don't care. I just want to be a doctor. Well, he said, well, I want you to go to SOM. It's a great school. And I picked up the phone, called Miss Watkins. Thanks, Miss Watkins, for listening to me. And that's how I end up here. And he said one thing in his last words. He said, Leke, one day you're going to be a doctor. And students are going to knock on your doors. Do not ever close your door behind them. Always reach out to help others that are coming behind you. And that's what drives me every single day, because somebody who doesn't know who I was from anywhere opened his doors while he was busy working on admissions and heard my story. And I'm committed to always listen to students. Anytime. I will spend hours on the phone with any students. Call me anytime and hear your story, because somebody did, and that was my commitment. I'm a businessman now, so I've learned a lot about business, and my career allows me to do that. And I've been giving back by teaching others the knowledge of medicine. So I love Les Brown, one of my favorite inspirational authors. He said, to be successful in life, you must be willing to do the things others wouldn't do today. So tomorrow, you can have what others won't have. That's a summary of it. Do what others won't do today, so tomorrow you can have what others won't have. And that's my family. That's our little son, Alamide. That's my wife. I love her to death. So I'm going to share with you some keys to success with my parting words. These are the top 10 things I've learned that's helped guide me over the last couple of years to who I am today. The first thing is to set goals for your life. Nobody else can set goals for you. Set little goals, set big ones. And always celebrate your goals every time you accomplish one. Be happy and be excited about it. Get a mentor, all right? Remember, the people that stand on the shoulders of giants can only see far. Trials can only make you stronger. Gold has to go through fire before it becomes gold, so is diamonds. So, we all have to go through our trials and tribulations in life. So is the path of medicine. You're going to be dealing with the mortality of human beings and have their lives in your hands. It's the most privileged honor to be able to be in that position, because you're top 3% in the world to be able to do this. All right? And you're learning from the best of the best. So, remember, this trials only makes you better, so in the end, you can be able to help your own patients. Please don't burn out. Let me say that again. Don't burn out. Over the last 2 years, I've read so many articles on Medscape and AOA and the AMA publishing constantly about burnout in medicine. Okay, we sacrifice our lives for others, but please, not at the expense of your own life. If you're not available to take care of your patients, then what's the point? Take the 5 minutes to exercise and take a walk. Eat good food. What you put in your body is who you become. Okay? Smile. Have fun. Medicine is hard. Yes, that's why we signed up for it. That's what makes us doctors. But still, you want to do the things that make you happy so that you can have a fulfilled life. Now, remember, pick your life first and then pick your specialty next. That is very important, because it's going to determine the course of your life for the next 30 years, whether you're going to be happy or miserable. Trust me, no amount of money can make you happy if you got to wake up 2 a.m. to do something you don't love. Don't sacrifice your life in medicine, and always find passion and explore it. There's more to life than medicine, guys. There is truly more to life than medicine. Sometimes you feel like medicine is your whole life, but if you find other passion, please explore it. If you like to play the guitar, the piano, I like to play the piano. I play the piano at home with my son. I learn on YouTube. Go figure. So explore it, so your life can be more richer, okay? Read non-medical textbooks. This is probably one of the best books I read, White Coat Investors. Okay, Dr. Dale wrote this book. It gives you a path of how to become a successful physician. There's so much you don't know, but one thing I know about doctors is this. If you have the brain power to be able to memorize Robbins and know all like staff warriors and your senior and you can learn anything. Put 1% of your brain to any of this stuff, you're better than any stockbroker, you're better than any of these guys out there. I'm serious. I fired my stockbroker. All I did was read 4 books and I figured out what he was doing. So, it's true. You guys are the smartest people in the world. Put 1%, not 99, 1% of your brain power to learn other stuff. Richest Man in Babylon, a great book. This list, I have a whole library of audio books. And guess what? You don't have to sit down to read it anymore. They have them in audio form. So you can be driving to your residency or driving around and be listening to books. I listen to a book a month. Now, this one is in red for a reason. He says, let me read it. Be careful whom you marry. Now, you're going to spend 12, you've sacrificed your adolescent life, you've sacrificed your young adult life, your teen years when your young fellows and your friends are basically hanging out at the bar, having a good time, finish 4 years of school, making $50,000, and you go deep down into debt, 250 grand, 4 years of medical school, and then you graduate, somebody pays you $50,000 a year. You're worth negative 250. Hold up. Negative 2, plus interest. It does come with interest. I saw that. I was like, wait a minute. Where did that come from? They said, oh, that's the interest you owe for the last 3 years. I'm like, 60,000? They said, yeah. But it's my investment, my education. So I can't complain. And then, to make the most important decision of your life, don't let somebody come and ruin it for you. 12 years of work? No. I wouldn't do that. So my wife had this little sign in our house. It says 21 suggestions for success. Remember, it's a suggestion. And it says, the first one says, be careful whom you marry. And the last words was like, this single one decision will determine 90% of your happiness or misery. This one single decision in your life will determine 90% of your happiness or misery. Imagine working 60, 80 hours a week and coming home to a broken home. That's the beginning of depression. That's how you start drinking, taking Vicodin, popping pills, try to surmount the pain. Please be careful. I know Robinson Pathoma is important right now. Right? And COMLEX, but they'll pass. Actually, it's not 90%, it's 99%. Hold on to your faith. I'm a Christian. I believe firmly in God. He's got me through the hardest times of my life when I was crying in the little closet, and my wife called me and said, honey, it's going to be okay. But I had to pray, fast, do whatever I had to do, because I've learned something in medicine. Even with all the advances we've gone through and come so far, your patients are going to die on you someday. And it's going to be one of the most painful things you have to witness as a human being. And you have to cuddle and hug their families and say, I'm sorry. I've tried everything I've done possible. Try to resuscitate your dad or your mom or your brother. I couldn't do more. And then you see that we're all mortals in the end. Although we are blessed with the gift of healing, mortality is inevitable. So if you don't have something to fall back on, it makes it hard. For me, it's my faith. When I cry with my patients, when I go home, I can say, God, thank you for the life that I have, that I'm able to wake up in good health, and I'm able to walk without being in pain and chronic pain medications. I just thank you. And finally, I leave with these words. Remind yourself of how special you are and how privileged you are to become a physician, to learn the best of the best, to be in the greatest country in the world, the United States of America. To be able to walk into a room and just with your knowledge, be able to solve a problem. Like I had a little 6-month-old a few months ago, whose mother ran into my emergency department in a freestanding ER while I was trying to order chicken for my colleagues, and it was a blue baby. And it was 6 months, and this baby was seizing, and basically hypoxic with an O2 sat of 72%. And I had to act so quickly, figure out what's going on while the father's crying in the corner, and the dad and the 6-year-old daughter is trying to walk up to his little brother. And I had to intubate this child, sedate him, give him Tylenol, and then basically paralyze this boy, and resuscitate him. Doing chest compression at 6 months, he has this tiny little 2 teeth, and I will never forget. And I'm thinking about my own son. And just came out of daycare. And when I sent that child down to the medical center, I looked up his records the next day. He was extubated, the child is well. And it was the best feeling in the world for me to know that with just the fact that I had this knowledge, I was able to save a life. And that made me realize how special we are. Thank you.
Thank you so much, Dr. Adesina, for making the trip all the way from Texas to come and be with us tonight. On behalf of the entire school and the entire SNME board and student body, we want to give you a token of our appreciation. So this jacket is for you to wear around the hospital so people know your alma mater, people know who gave us Dr. Adeleke when you're in the hospital, okay? And also you have a certificate that comes with it.